Atracurium. Expanded lecture notes. Atracurium is a non-depolarizing neuromuscular blocking agent (NMBA) used in anesthesia and critical care for muscle relaxation. It has unique properties like organ-independent elimination via Hoffman degradation and ester hydrolysis, making it particularly useful in patients with organ dysfunction. The following notes expand on its pharmacology, clinical use, advantages, disadvantages, and more. Introduction to Atracurium. 1. Atracurium is a non-depolarizing neuromuscular blocker (NDNMB) of the benzylacetoquinolineium class with intermediate duration of action. It relaxes muscles during surgery or intubation. 2. It is unique because it undergoes Hoffman elimination and ester hydrolysis, making its metabolism independent of renal or hepatic function. This means Atracurium breaks down in the body without relying much on kidney or liver function. 3. This property makes Atracurium especially useful in critically ill patients with multi-organ failure. Atracurium can be a good choice for very sick patients with problems in several organs because it breaks down predictably without needing much organ function. Definition of Atracurium. Atracurium is a competitive antagonist of nicotinic acetylcholine receptors at the neuromuscular junction, producing skeletal muscle relaxation without causing depolarization or fasciculations. It blocks acetylcholine receptors on muscles. This leads skeletal muscle relaxation needed for surgery or procedures. It doesn't cause initial muscle twitches, fasciculations, like depolarizing muscle relaxants might. History of Atracurium. 1. Developed in the late 1970s by scientists at Wellcome Research Laboratories. Atracurium was created during this time by researchers. 2. Introduced clinically in 1983 as an intermediate-acting NMBA with organ-independent metabolism. Atracurium started being used in medicine in 1983 because it doesn't rely much on organs like liver or kidneys to break down. 3. Remains valuable in ICU settings and anesthesia for patients with liver or kidney dysfunction. Atracurium is useful in critical care and for patients with problems in liver or kidney function because of how it breaks down in the body. Classification of Atracurium. 1. Pharmacological class. Non-depolarizing neuromuscular blocker. Atracurium blocks muscle contraction without causing initial muscle stimulation. 2. Therapeutic class. Skeletal muscle relaxant benzylacetoquinolineium type. Atracurium is used to relax skeletal muscles for surgery or other medical procedures, and it belongs to the benzylacetoquinolineium group of drugs. Chemical properties of Atracurium. 1. Chemical name. 2. 2-feet-1. 5-pentanetylbis oxy 3-OXO3. 1-propane DIYL bis 1-3. 4-dimethoxyphenyl -3 2-propenyl -1. 3-propane dibromide. This is the full chemical name of Atracurium. 2. Molecular formula. CH-bridge-NO. This shows the composition of Atracurium in terms of atoms. 3. Molecular weight. 1243.2 grams per mole. This is the weight of one molecule of Atracurium. 4. Structure. Bis-quaternary benzylacetoquinolineium compound. Atracurium has this specific chemical structure. 5. pKa. Approximately 8.15. This value relates to how Atracurium behaves in terms of ionization in the body. Physical properties of Atracurium. 1. Appearance. Clear, colorless to pale yellow solution. Atracurium comes as a liquid in this form. 2. Solubility. Freely soluble in water. Atracurium dissolves easily in water. 3. Formulation. Supplied as Atracurium bezylate injection for IV use. Atracurium is given through a vein IV as Atracurium bezylate. 4. Stability. Store refrigerated at 2 to 8 degrees Celsius, stable for approximately 14 days at room temperature. Atracurium should be kept cold but can stay usable for about 2 weeks at normal room temperature. Mechanism of action of Atracurium. 1. Competitively binds to nicotinic acetylcholine receptors at the motor end plate, preventing acetylcholine from triggering depolarization and muscle contraction. Atracurium blocks the action of acetylcholine on muscle receptors. 2. No depolarization leading to no fasciculations or potassium release. Because Atracurium doesn't cause initial muscle stimulation, it doesn't cause twitches, fasciculations, or extra potassium release. 3. Blockade is reversible with acetylcholinesterase inhibitors, e.g. neostigmine. The effect of Atracurium can be reversed with medicines like neostigmine that help increase acetylcholine levels. Pharmacokinetics of Atracurium. 1. Onset, 2 to 3 minutes, intubating dose. Atracurium starts working in a few minutes for intubation. 2. Peak effect, 3 to 5 minutes. Atracurium's effect is strongest in this timeframe. 3. Duration, 20 to 35 minutes. The muscle relaxation effect lasts about this long. 4. Metabolism. Hoffman elimination, temperature and pH dependent, spontaneous breakdown in plasma. Atracurium breaks down in the blood in a way that doesn't need liver or kidneys. 5. Ester hydrolysis by nonspecific plasma esterases. Atracurium is also broken down by enzymes in blood plasma. 6. Elimination. Organ independent. Metabolites excreted in urine and bile. Atracurium's breakdown doesn't rely on organs like liver, kidneys. Its byproducts leave via urine and bile. 7. Half-life. Approximately 20 minutes. It takes about 20 minutes for half of Atracurium to break down. Pharmacodynamics of Atracurium. 1. Produces skeletal muscle paralysis without affecting consciousness or pain perception. Atracurium relaxes muscles for surgery but doesn't affect awareness or pain feeling. 2. Mild histamine release may cause transient hypotension and flushing. Atracurium can cause some histamine release leading to brief low blood pressure or skin flushing. 3. No cumulative effect with prolonged infusion due to predictable metabolism. Because Atracurium breaks down predictably without relying on organs, using it for a long time doesn't lead to build-up effects. Storage and disposal of Atracurium. 1. Store refrigerated 2 to 8 degrees Celsius to prevent breakdown. Keeping Atracurium cold helps it stay effective. 2. Avoid freezing. Atracurium shouldn't be frozen for storage. 3. Discard if precipitate or discoloration is observed. If Atracurium solution looks abnormal, it shouldn't be used. 4. Dispose unused drug as per hospital hazardous waste protocols. Get rid of leftover Atracurium following hospital rules for dangerous waste. Interactions of Atracurium. 1. Potentiated by volatile anesthetics, aminoglycosides, magnesium, lithium. These drugs can make Atracurium's effect stronger. 2. Antagonized by cholinesterase inhibitors, unless reversed intentionally. Drugs that increase acetylcholine can counteract Atracurium unless used on purpose to reverse it. 3. Additive effects with other NMBs. Using Atracurium with other muscle relaxants can increase the muscle relaxation effect. Clinical uses of Atracurium. 1. Facilitation of endotracheal intubation in elective surgery. Atracurium helps with breathing tube placement in planned surgeries. 2. Skeletal muscle relaxation during surgery or mechanical ventilation. Atracurium relaxes muscle for surgery or when patients are on breathing machines. 3. Neuromuscular blockade in ICU patients with multi-organ failure. Atracurium can be used in very sick ICU patients with problems in several organs. 4. Safe option for patients with significant renal or hepatic impairment. Use of Atracurium in ICU. 1. Preferred in patients with renal or hepatic failure because metabolism is organ independent. Atracurium is a good choice in ICU for patients with kidney or liver problems because it breaks down without needing these organs. 2. Use ARDS patients for improved ventilator synchrony. Atracurium helps patients with severe lung issues, ARDS, work better with breathing machines. 3. Minimal accumulation with prolonged use. Because atracurium breaks down predictably, using it for a long time in ICU doesn't lead to buildup in the body. Use of atracurium in anesthesia. 1. Suitable for elective procedures requiring intermediate muscle relaxation. Atracurium is useful for planned surgeries needing muscle relaxation that lasts a moderate amount of time. 2. Advantage in patients with organ dysfunction or unpredictable drug clearance. Atracurium is good for patients with liver or kidney issues because it breaks down predictably without relying on these organs. 3. Mild histamine release may be mitigated by slow injection. Giving atracurium slowly might reduce minor side effects like flushing or low blood pressure from histamine release. Use of atracurium in emergencies. 1. Can be used for urgent intubation, but slower onset than succinylcholine or high-dose rocuronium limits its role in true RSI. Atracurium can be used for quick intubation but isn't fastest like some other drugs used in rapid sequence intubation (RSI). 2. More useful for maintaining paralysis than initiating it in emergencies. Atracurium is better for keeping muscles relaxed after intubation rather than for the initial rapid intubation step in emergencies. Administration and dosage of atracurium. 1. Adults. Intubation. 0.4–0.5 mg per kilogram IV, 2 times ED95. This dose is used for muscle relaxation for intubation in adults. 2. Maintenance. 0.08–0.1 mg per kilogram IV bolus or infusion at 5 to 9 microgram per kilogram per minute. Additional doses or a continuous drip can keep muscles relaxed during surgery. 3. Children. Similar dosing to adults. Neonates be more sensitive. Kids get doses like adults, but newborns might be more affected by atracurium. Side effects of atracurium. 1. Flushing, hypotension due to histamine release. Atracurium can cause some histamine release leading to skin flushing or brief low blood pressure. 2. Mild bronchospasm, rare. Atracurium might rarely cause slight narrowing of airways. 3. Injection site discomfort. Some people might feel discomfort where atracurium is injected. Serious side effects of atracurium. 1. Severe anaphylaxis. Rare. Very rarely, atracurium can cause a severe allergic reaction. 2. Residual paralysis if not adequately reversed. If atracurium's effect isn't fully reversed after surgery, muscles might stay weak. 3. Seizure-like activity from metabolite laudanosine at very high concentrations. Rare in clinical use. A breakdown product of atracurium called laudanosine might cause seizure-like effects at very high levels, but this is rare with normal use. Contraindications of atracurium. 1. Known hypersensitivity to atracurium or other benzylosoquinoline NMBs. Atracurium shouldn't be used if someone is allergic to it or similar drugs. 2. Situations requiring extremely rapid onset of paralysis, RSI, unless pre-optimized. Atracurium isn't the best choice for rapid sequence intubation needing very fast action unless conditions are optimized for its use. Precautions for atracurium. 1. Use cautiously in hypotensive patients due to histamine release. Atracurium might cause more low blood pressure in patients already having low blood pressure. 2. Avoid rapid bolus in patients with asthma or severe cardiovascular disease. Giving atracurium quickly might be risky in patients with asthma or severe heart problems due to histamine effects. 3. Maintain normothermia and normal pH for predictable metabolism. Atracurium breaks down more predictably when body temperature and acid-base balance are normal. Advantages of Atracurium. 1. Organ-independent elimination. Atracurium breaks down in the body without relying on kidneys or liver. 2. Predictable duration, minimal accumulation. Atracurium's effect lasts a predictable amount of time and doesn't build up much with continued use. 3. Safe in renal and hepatic failure. Atracurium is a good choice for patients with kidney or liver problems because it breaks down without them. 4. Minimal cardiovascular effects if injected slowly. Giving Atracurium slowly reduces possible effects on heart and blood pressure. Disadvantages of Atracurium. 1. Slower onset than succinylcholine or rocuronium. Atracurium takes a bit longer to work compared to some other fast-acting muscle relaxants. 2. Histamine release potential. Atracurium can cause some histamine release leading to side effects like flushing or low blood pressure. 3. Requires refrigeration. Atracurium needs to be kept cold to stay effective. Clinical considerations for Atracurium. 1. Ideal for ICU patients with multi-organ failure. Atracurium is a good choice for very sick ICU patients with problems in several organs because it breaks down without relying on organs. 2. Avoid rapid bolus to reduce histamine-mediated hypotension. Giving Atracurium slowly can reduce the risk of low blood pressure from histamine release. 3. Train of 4 monitoring is recommended during use. Checking muscle response with train of 4 helps guide Atracurium dosing and reversal. Comparison of Atracurium with other agents. Atracurium. Onset IV 2 to 3 minutes. Duration 20 to 35 minutes. Metabolism. Hoffman degradation plus ester hydrolysis. Organ dependence. No. Histamine release. Mild. Rocuronium. Onset IV 60 to 90 seconds. Duration 30 to 60 minutes. Metabolism. Minimal hepatic. Organ dependence. Minimal. Histamine release. No. Vicuronium. Onset IV 2 to 3 minutes. Duration 25 to 40 minutes. Metabolism. Hepatic. Organ dependence. Yes. Histamine release. No. Succinylcholine. Onset IV 30 to 60 seconds. Duration 5 to 10 minutes. Metabolism. Plasma cholinesterase. Organ dependence. No. Histamine release. No. Additional information about Atracurium. 1. Laudanosine, a metabolite, can cross the blood-brain barrier and is associated with CNS excitation in animal studies. Accumulation is possible with very prolonged infusion, but clinical seizures are extremely rare. A breakdown product of Atracurium called laudanosine might affect the brain in animal studies, but actual seizures in patients are very rare. 2. CISATRACURIUM, a stereoisomer of Atracurium, was developed to reduce histamine release while maintaining organ-independent metabolism. CISATRACURIUM is a related drug that causes less histamine release and also breaks down without relying on organs like kidneys or liver. Research on Atracurium. 1. Studies comparing laudanosine levels in prolonged ICU infusions of Atracurium versus CISATRACURIUM. Researchers are looking at how much laudanosine, a breakdown product, is made when using Atracurium versus CISATRACURIUM for a long time in ICU. 2. Investigations into pH and temperature modulation to optimize Hoffman elimination rates. Researchers are studying how changes in body pH and temperature might affect how Atracurium breaks down in the body. Research on Atracurium. 1. Studies comparing laudanosine levels in prolonged ICU infusions of Atracurium versus CISATRACURIUM. Researchers are looking at how much laudanosine, a breakdown product, is made when using Atracurium versus CISATRACURIUM for a long time in ICU. 2. Investigations into pH and temperature modulation to optimize Hoffman elimination rates. Researchers are studying how changes in body pH and temperature might affect how Atracurium breaks down in the body. Conclusion about Atracurium. 1. Atracurium is a reliable, organ-independent NMBA suitable for patients with hepatic or renal impairment. Atracurium works well for patients with liver or kidney problems because it breaks down without relying on these organs. 2. Its slower onset limits RSI use. Its predictable metabolism and safety profile make it valuable for ICU and elective anesthesia settings, especially in multi-organ failure. Though Atracurium isn't fastest for rapid sequence intubation, its predictable breakdown and safety make it full in ICU and planned surgeries, especially for very sick patients with problems in several organs. Professional quote about Atracurium. Atracurium is the steady hand in neuromuscular blockade, predictable, forgiving in organ failure, and dependable when the long game matters. Critical care neuromuscular management principle. This quote means that Atracurium is a reliable choice for managing muscle relaxation in critical care. It's predictable in how it works well even if patients have liver or kidney failure. Forgiving in organ failure, and is dependable for longer-term management. When the long game matters. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.